Welcome, and thank you for joining us today for this important conversation about COVID-19 and the ALS community. Every May during ALS Awareness Month, we focus on ALS, and this Facebook Live event is one of many resources MDA is providing throughout the month and beyond. MDA has been on the front line of ALS care and research for decades, in fact, for more than 70 years. So while May is an important month for ALS and MDA, we know that every month and every day matter. I'm Kristin Stephenson, MDA's Chief Advocacy and Care Services Officer, and I'm looking forward to our conversation today. And I'm honored and joined today by Matt Harms, who serves as a medical advisor to MDA and who is an ALS expert.
Hi, Kristin. It's a real pleasure to be here today, and I hope the information we can provide is helpful to the community.
Thank you. And Dr. Harms, if you don't mind, I know we were chatting right before we kind of officially started the program here a few minutes ago, and you were sharing your personal experience with COVID, and we appreciate in advance your willingness to share this with the community. Thanks so much for letting us have some insights on how this has impacted you and your family.
You bet. So to begin with, we're here in Manhattan, which is, of course, the nation's epicenter of COVID. And not through any glorious service in the hospital, but actually just hanging out and playing with neighbor kids. 3 members of my family, including myself, all came down with COVID. Thankfully, we all had mild symptoms. And because I'd been exposed, I was then able to go back into the hospital and help take care of patients with COVID here at Columbia. So yes, we've been impacted very minorly, and our hearts go out to those who are experiencing this in a much more profound and difficult way.
Well, we thank you so much for everything you and all of your colleagues in the healthcare space are doing on the front lines. It's really remarkable, and we're so grateful for you to take more time out of your very busy schedule to chat with us today. And for everyone who's joining us today, we're thrilled to have Dr. Harms with us as a medical expert, but please understand he's not providing medical advice during today's program. Any decisions about your care should be made in conjunction with your doctor. We know that this is a great time of really unprecedented uncertainty for the ALS community, and we at MDA are here to help and are more committed than ever to our mission to serve the ALS and the neuromuscular community. And we know that you have important questions related to COVID-19 and how COVID affects those living with ALS, and we look forward to spending the next half hour answering your questions. And before we get started, I did want to take just a moment to note that we are only able to do what we do at MDA because of the generous support of the community, donors, and all of our supporters. As a nonprofit organization, we are dependent on fundraising to execute our mission, and there's always someone, and often many people, to thank for everything we're able to do. So at the end of today's program, I'm going to take just a moment to thank some of our supporters and to let you know ways that you can get involved in helping ensure that our mission work can continue. And now let's get started. Thank you to everyone who responded to MDA's COVID-19 survey and to everyone who submitted questions in advance of today's webinar. We've incorporated those into the program, and we will do our best to address as many of them as possible during the time we have together today. So Dr. Harms, our first question is, what about ALS makes someone particularly susceptible to COVID-19?
Absolutely. So, we're still very early on in understanding what makes someone susceptible to developing COVID-19 disease. It may not be the case that people who have ALS are more susceptible to getting it, but it may be the case that if they do get it, their symptoms could be worse than someone who doesn't have ALS. The main thinking behind that is that if you already have respiratory compromise, if the muscles surrounding your lungs are weak, that then the effects of the virus, the pneumonia that it causes, could be more severe and more difficult to get over for somebody who has ALS. So we don't know yet, to emphasize, whether people with the disease with ALS are more susceptible to getting it. But if they do, there's some concern that it would be more severe. How much more severe is probably dependent on how severely affected the lungs are at this stage of ALS, and also what other diseases you might have. So we know that heart disease, that a history of smoking, that age are all risk factors for having a worse outcome from contracting COVID. And so, everyone's risk is going to be a little bit different, but it's likely that if there's significant respiratory compromise with ALS, the disease might be worse if you contract it.
Thank you. And the next question is really about symptoms, COVID symptoms, and how to know what is a COVID symptom and how to know what might be just a reality of living with ALS. Sometimes they can have a bit of confusion between the two. And the question reads, I've heard that there are some new COVID-19 symptoms, and it seems like some COVID-19 symptoms might seem like typical ALS. Do you know what is because of ALS and what might be a sign that I have COVID?
Yeah, I think the reality is that almost all of America is running around wondering whether their sniffly nose or their itchy eyes or their chest tightness or so many things have us all worried about having contracted COVID-19. It is a little harder to tell in patients with ALS. If you have lung compromise or swallowing compromise, you might aspirate a small amount, and that can cause lung inflammation and fever and shortness of breath, things that definitely overlap with COVID-19 symptoms. Another prominent symptom for people with COVID-19 is fatigue and muscle aches, and we know that that's quite common in the ALS population. So I think a good rule of thumb would be that if in the preceding weeks leading up to when you think you might have symptoms, the symptoms were brewing, like fatigue was gradually increasing, shortness of breath was gradually increasing, it might not be COVID-19. But that's a determination that you need to make with your physician. So I think that the wise course of action, if you're worried that symptoms that you're developing might be COVID-19, would be to reach out to your ALS care team or your primary care doctor or the local COVID-19 referral hotline, however it's working in your community, to get that assessed. The earlier you catch COVID-19 or any of the other things that could be causing those symptoms, like pneumonia from bacteria or strep throat or some other disease, the easier it is going to be to treat it and manage it.
And the next question is about caregiver concerns. And the question reads, I'm concerned that my caregiver will get the virus. What should I do if that happens?
Yeah, that's a really great question, and one that my family faced. We had 3 young children who are relatively mature and responsible, but not yet able to care for themselves. So when my wife and I both came down with it, we had to try to scramble and figure out care plans that would protect our kids maximally, especially one of them who has some medications that make her more susceptible. So I think the most important take home is to have plans for if that happens. For most of you out there, it's going to be unlikely that a caregiver of yours would come down with it, but what would you do in that situation? It would be good to take some time to think about who the backup caregivers might be, who might be able to take on some of the responsibilities that your caregiver currently has. You could touch base with your ALS care center to find out what other additional care resources, respite care, home health aides, things that could be utilized in a pinch should one of your caretakers fall ill with COVID.
I think that's great advice, and thank you for that. I think that one of the things we're all searching for, quite frankly, in a time of uncertainty, is any way to reduce the uncertainty. And I think the suggestion to have a plan in place, even if that plan has to evolve and change to reflect the kind of changing realities, is something we could all certainly take to heart and put in place.
Yeah, I think I was just
No,
going
go
to
ahead.
add that this is actually a good opportunity to put in place and have some conversations around emergency planning in general, to know kind of what your healthcare directives are, know where they are, remind yourself where they are, make an extra copy, photograph them on your phone, all sorts of different things that we should have gotten to and put into place that the isolation maybe gives us an opportunity to do, and reminds us that it's important to do it.
No, that's a great point. The next question refers to an individual's care center. So let me take just a moment to describe what a care center is for those who may be joining us today who aren't familiar. MDA supports a network across the country of medical clinics, multidisciplinary. Collectively, we refer to them as the MDA Care Center Network. And the network is comprised of more than 150 multidisciplinary clinics across the country at top healthcare institutions like Columbia University, where you are, Dr. Harms, of course. And the question reads, my care center wants me to have a virtual medical visit, but I would rather wait and go in person. What should I do?
Well, Kristin, we all agree that in-person healthcare is ideal in many ways. Our physical exams are more reliable. We're able to, assess the person in person and have that personal contact that actually can make a big difference. But I think what we're learning by being forced kind of all of a sudden to go to telehealth is just how powerful a tool that can be. Um, we've had patients like the questioner that you just read from, who have been reluctant to do telehealth, and what I've been telling them is that it's actually really important for us to touch base, see how things are doing right now, and be able to help troubleshoot. And so far, I think every one of them would tell you that I was able to elicit issues that they hadn't thought to bring up, or that they hadn't wanted to burden us with, and ways that we've been able to move their care forward even while we can't see them in person. A lot of what we do in the clinic is very well replicated over telehealth. The other point I would make about the hope of holding off and waiting until medical centers reopen and you can come in person is the fact that everyone is going to want to come in person at the exact same time when the medical centers open, and so there will be some triaging that takes place. And so if you're don't have an urgent or emergent issue in those first early months after reopening, it may be difficult to get an in-person appointment. And so what we don't want to do is have you go months and months and months without help from the care center, help troubleshooting, spotting future issues, getting equipment in place, all the things that we can very effectively manage over telehealth.
And I think that one of the things that we've heard from the community as well, particularly through the COVID-19 survey that we conducted at MDA, is that sometimes, especially for folks who may not have had the opportunity to participate in a telemedicine visit before, there may be a little bit of apprehension just because it's additional uncertainty. It's just another scenario where someone might not necessarily completely have the information they need to be comfortable to go into it. And so to try to MDA is hosting an MDA Engage webinar on Friday, May 15th at 7:30 p.m. that is all about what is telemedicine and virtual medical visits, and tips and suggestions that you can do to be prepared for such a visit. And additional information and to register for the webinar, which is of course free of charge, is at mda.org/engage, and you can just click on the webinar section and you will find it there. The next question, Dr. Harms, is what should I do if I need a medical visit, but my doctor is not offering virtual visits?
Right. So that is a complicated thing. I would say that probably 90% of practices have incorporated telehealth at some level. So if a virtual visit using telemedicine is not possible, many centers are making do with telephone visits, which is not ideal. But can accomplish many of the same things if it's not something that has to be visualized or seen in person. The other thing that's occurred is the Center for Medicare has relaxed the requirements for telehealth, such that physicians in one state can provide medical care by telehealth to patients in another state in which they're not licensed. So in a pinch, you might be able to have a telehealth visit with a nearby MDA care center if they have the capacity for doing that. But I also would hazard to say that probably most internal medicine and primary care physicians have this up and running. And so maybe reaching out to them to have a telehealth visit with your primary care doctor could help bridge the gap till you can either get back in the clinic or your MDA care center can establish telehealth as a way of seeing patients.
I'm really glad you mentioned the relaxing of the restrictions, because I know that through conversations we're having with clinicians in the care center network, this really is having a positive impact on being able to provide consultation services virtually in a way that they haven't been able to as easily before. And certainly we hope that having access to telemedicine will be one of the positive attributes that will come out of what is obviously a serious public health crisis. In your experience conducting telemedicine visits, what are some of the best advantages of that medium that you're finding now that you are completely in the throes of full telehealth visits yourself?
Yeah, so I think one of the advantages is that caregivers who don't live with you can attend depending on the platform that's being used. Our platform allows multiple individuals to have the invite and to phone in. So we can have language interpreters, we can have siblings, parents, uh, adult children who live out of state actually calling in and being part of the visit, which is actually really great. Additionally, we get a sense for the patient's home environment, so we can actually assess how the walker fits through the doorway, or see the power wheelchair, maneuvering in its native environment, as it were, which gives our physical therapists and occupational therapists a lot of insight into what types of troubleshooting ideas might be helpful for improving quality of life and function at home. Finally, I think most patients will tell you that somehow making it into Manhattan and parking at Columbia for however much our garage charges and schlepping through the city is a real hassle as disability mounts with ALS. And I'm sure even in suburban areas where there's a parking lot and much easier access, that can be a challenge also. So people are really appreciating the absence of a commute. And so I think
Mhm.
those things are compensations for the fact that we can't do everything. We can't accurately measure people's breathing capacity. It's very difficult to do a reflex exam over telemedicine. If someone has an idea, please email me. But I think that there are a lot of advantages that people are greatly appreciating by telemedicine, and I predict that as COVID-19 goes past us, we will fight very hard to maintain some level of telemedicine as a routine part of our ALS clinical practice.
Mhm. Building makes good sense, especially as some of the things we've been talking about around clinical trials. And this is actually a great segue into the next question, which is how is COVID impacting ALS clinical trials? And I know that you had shared with me also some of the functional type tests that can be done exceptionally well in a remote environment, in a virtual environment. So if you wouldn't mind sharing with us about the impact on clinical trials and maybe some examples of those tests that can be done quite nicely outside of the clinic setting, that would be great.
You bet. So most medical centers, to protect participants in clinical trials and the staff that perform the clinical trials, have limited the number of patients and people that can come on most medical center and hospital campuses. As a result, almost all clinical trials at Columbia that haven't yet shown benefit to patients or aren't related to COVID have been halted. And this is true at many medical centers across the country. Everyone is astutely aware, though, that we want clinical trials for ALS to get up and running as quickly as it is safe to do. There have been a number of great webinars by the Northeast ALS Research Consortium. You can find them on their website. The webinars are there. Dr. Jinsey Andrews and Timothy Miller fielded questions and gave an overview of why it's important to have halted the clinical trials and how we plan on ramping them back up. One of the things that this shutdown has spurred, however, is lots of additional energy and effort into figuring out how to do clinical trials from home, or shift the burden of participation in clinical trials to patients' homes instead of always having to come in. Can we measure things accurately, reliably, and reproducibly in your home environment instead of having you come to the clinic? There are some measures that are already up and running. It's now possible. Well, I mean, it's been possible for a number of years to measure the ALS functional rating scale reliably from home. People are working on tablet and iPhone-based apps to measure manual dexterity, to record your voice and have it analyzed to assess progression for dysarthria. There are home spirometry units that people are getting used to. And so hopefully in the future, clinical trials will be more engaging at home, and we even potentially could, for some types of clinical trials, foresee an entirely at-home battery for most of the assessments. We're not there yet, but we're moving towards that, and the COVID-19 shutdown has definitely lit a fire under the community to make sure that we move that forward as quickly as possible.
It's really exciting, and we know that certainly with ALS, time is of the essence in every aspect. And the faster we can make changes like this happen, the better. This is an area that MDA is particularly interested in and has been very engaged in on the advocacy front. And as you know, MDA has been dedicated to accelerating therapy development since our inception, and clinical trials are the essential step from being able to move something from the investigational stage further along the process to be able to potentially be available to people. And so in conjunction with that interest, on Wednesday, MDA filed comments with the Food and Drug Administration asking them to issue further guidance to developers and advice on successfully transitioning clinical trials from trial sites to closer to home, including within the home itself, and kind of following the same theme that what we need to do is see the way we conduct trials change, not stopping trials until things return to what we're familiar with. We're very optimistic about the dialogue that's been opened up in the clinical research and in the regulatory community about this. And it does seem like there's a lot of interest in really working collaboratively to see those kind of things move forward. So I think it's good news. The next question, Dr. Harms, reads, if my loved one gets COVID-19, how can I keep them at home and treat him here? Will they let me be in the hospital with him as I'm the only one who can communicate with him?
That's a really good question. And I would say at least once a day, a question that I'm fielding from one of my own ALS patients here in New York. Of course, here in New York, unfortunately, there is a real risk if you go out of your home for any reason of contracting the disease because it's just circulating at such a high level. Thankfully, that's leveling off a bit, but it's still at a high level. But there are many parts of the country where that risk is not that high. And so if you need medical care, check with your local hospital, the hospital where you would be taking your loved one, to see if, in fact, they are prohibiting visitors. It may very well be possible under the circumstances that were just described to accompany the patient. Especially if there isn't a major shortage of protective equipment that you would need in order to keep yourself safe and keep others safe. The other thing I would point out is that, hospitals are, even ones like Columbia, where there are lots of patients with COVID, are relatively safe places because of all of the disinfecting and sterilization and all of the protocols that have been put in place to limit the spread amongst the healthcare providers that are taking care of the patients, as well as those coming into the emergency room for reasons other than COVID. So if you need medical care, it is still smarter and better to go to the emergency room. If you need emergent medical care, it is still better and smarter to go than to put it off. We have seen, and people have been reporting this recently, spikes in causes of other deaths over the baseline. And we think that that's because people are avoiding coming to the hospital for fear of COVID. And whatever it was that they had that could have been potentially treatable is progressing to a stage where it's life-threatening. So if you need medical care, definitely seeking it out is important. Hospitals are doing everything they can to prevent the spread from patient to patient within hospitals. And I wouldn't let that be a barrier. If you have questions about kind of how that's being handled in your local community, you should consult your healthcare providers that are either part of your ALS care team or primary care doctor, someone who knows what the situation is like in your local region.
Mm-hmm. Thank you. The next question is about vaccines and potential vaccines. The question reads, I've been told I should not take the annual flu shot due to ALS. If a vaccine becomes available for COVID, will people with ALS be able to take it?
So I guess I would back up and say that it is a recommendation that everyone who is not allergic to egg products and to vaccination does in fact get the annual flu vaccine. Because pneumonia in general is more common if you have respiratory compromise, it's actually quite important to get the flu vaccine on an annual basis. We encourage our patients to get it as soon as it's available so that they have maximal protection throughout the season. And if you're in an age group where sometimes vaccine strength wanes, sometimes a booster dose is necessary later. The same will be true for the COVID vaccine if it proves to be safe. And of course, no one's going to release to widespread use a vaccine that has major neurological or complications otherwise. But I am guessing to say that our general recommendation would be yes, vaccination with the COVID vaccine will be recommended when a safe one is available.
Thank you. Thank you for clarifying that. That's obviously an important distinction to be able to for the group participating today. The next question is something that is really, I think, pervasive for all of us, certainly in the current situation, but particularly within the community. And the question reads, I'm feeling really distant from everyone. What are some things I can do to help from feeling alone and isolated?
Yeah, that's a really good question, and a very common experience. People even surrounded by other people, family members, friends, other people that they may be self-quarantining with, you can still feel lonely in a crowd. And so it is very important, if you're feeling that way, to reach out for resources and to practice self-care. There are lots of resources that can be found on State Department of Health websites, call centers. If you're feeling that you don't have anyone local that you can reach out to. The same is true if you are feeling unsafe in your home and experiencing threats of domestic violence. So it is important to take those things seriously and to reach out for help if you're experiencing any of those things.
I think looking for resources is a great recommendation, and I would add also that MDA has developed and posted an on-demand webinar specific to caring for oneself with ALS during COVID-19 that addresses how to stay connected during a time of social distancing, and share some tips and resources for helping maintain good mental health during this time. If you're interested in watching this, it is available for you to view at your convenience. It is on demand. Of course, no cost associated with viewing it. And you can find the webinar at mda.org/engage. And if you click on community webinar, it will take you to the webinar. And Dr. Harms, we have time for one last question today. And this is one I know everyone is quite interested in, which is, I heard that there is an antibody test. Should I require my caregiver to take the test? And where can someone go to do that?
So, there are some 15 different antibody tests that are currently in development in different stages of testing and approval. And each one has different characteristics. Sometimes these tests have been in the news recently for missing antibodies in people who have for sure had COVID, and also for identifying what look like COVID-19 antibodies when in fact the person has had a related coronavirus and didn't have COVID-19. So I think the general sense is that we don't know enough yet about the antibody tests to make a firm recommendation, and also that we don't know enough to make plans, based on for the caregiver testing scenario that you were just discussing. So stay tuned. Things are changing rapidly, and we may know, over the next weeks to months about whether the antibody test is specific enough that if you have antibodies, you can say that you did in fact have COVID. And at the moment, getting a hold of one of those tests is challenging depending on where you live. So there isn't, to my mind, a ready way to get antibody testing or to know what types of decisions to make based on it at this point.
Well, thank you, Dr. Harms, and thank you again for sharing your insights and your time with us today and for everything you do. Thank you all for being here with us today. And I do want to take a moment and say some special thank yous to those who allowed today's programming and for MDA's mission really to be possible. Due to the pandemic, we at MDA are having to think about new and different ways to fund our mission because having in-person events is obviously not possible at this time. So tonight we're kicking off our virtual events program with a virtual gala at 7 p.m. Eastern, and everyone is invited to join. We hope you will join us, and you can find us on MDA's YouTube channel at youtube.com/MDA. I also wanted to take a moment to thank an amazing partner of ours, Dutch Bros Coffee. And Dr. Harms, you're a fan of Dutch Bros and know them well, as you're from Oregon, as they are. And Dr. Harms, I know that you know others may not, that Dutch Bros co-founder Travis Boersma started a program called Drink One for Dane 14 years ago when his brother and Dutch Bros co-founder Dane was diagnosed with ALS. And Drink One for Dane remains a way to honor the legacy of a man who was known to inspire positivity all around him. And Dutch Bros, as MDA and as you, are committed to continuing the fight until a cure for ALS is discovered. And this year you can participate by going to dutchbros.com/endals and donate virtually. We're excited that everyone in the country will be able to participate in Drink One for Dane Day this year. And thank you to Dutch Bros for being such an enduring partner and being so committed to ALS. And lastly, I'd like to thank you to Cytokinetics for their generous support of this Facebook Live event. Thank you all. And please do keep up with current information on MDA's COVID landing page. We have a resource center available that is being constantly maintained and updated with additional information and with resources. You will find this Facebook Live recording available for viewing there as well. And you can find all of this information at mda.org/COVID-19. Thank you again, Dr. Harms.
You're very welcome. Thanks for having me.
Thank you. Did you have any final words you wanted to share with the group today?
I do. I think sometimes patients are reluctant to reach out for the help they need from their care center. Yes, we're busy. Yes, there's lots of stuff going on, but we are here to try to make your lives easier as you wrestle with ALS. So definitely reach out if there are ways that your care center can help. I'm sure the staff there is as devoted as ours are here to trying to help us get through this crisis together. Thanks.
Thank you, Dr. Harms. Perfectly said. And I wanted to add that I saw a marquee the other day that I thought really summed up where we want to be as a community together well. And it said, be kind, be well, and be safe. So we hope all the same for you and yours. And thank you again for joining us today.